Hi, Floppycatters. Today I have Jonathan Lowe. Is that right?
You got it.
Okay.
Nailed
I
it.
just asked him. I have known Jonathan since 2020, and I just now asked him how to pronounce his last name. Or no, I asked, is it pronounced Lowe? And you said no, it's Lowe. And I wanted to have Jonathan on because he is the owner and founder of O3 Vets, which is a company that produces products so you can do ozone. Vet can do ozone, or a cat you can do it at home on your cat or dog. And that's how Jonathan and I got introduced because I did it on my parents' Camus in 2020. Jonathan, thank you for being here.
Thank you. I'm excited to be here.
I'm excited you're here. So the reason I wanted to have Jonathan on is because I would like to see ozone in every vet for it to be as normal as, I don't know. I can't think of something that's like common in every single vet, but whatever that would be, like blood draws.
Antibiotics.
Yeah, well, yeah, there you go. That would be awesome. So I was on a walk before our call today, and I was like, what could I ask him about? And I was like, it's just endless with ozone of the things that it can help with. But anyway, before we get started, what is ozone?
Ozone is a gas. Most people, when they think of ozone, they think of the ozone layer, which makes
Yes.
sense. Um, but it's a gas. It's I say oxygen on steroids because oxygen's O2, ozone's O3, so just one more oxygen molecule, but it makes it reactive. In fact, I was just talking to somebody right before this conversation who was doing it at home about that. She's like, how should I understand ozone like?" And she's like, "Isn't it kind of like oxygen?" And yes, it is. But it makes it reactive because they're sharing those three oxygen molecules are sharing electrons. They don't share well. And so it's always looking to break back down to oxygen. But it's in the atmosphere, but we can also create it, and we can create a more pure form of ozone that can be used medically for a lot of things. As long as it's administered properly, it's a great antimicrobial. It's great to reduce inflammation, and to increase oxygen utilization and a number of things that it can really help with.
Yes. So how I found out about ozone was so it was 2020. We all know what happened that year. And my parents' cats were 15. I was trying to see if I had the timeline
Mhm.
correct. And they did not get to go to their regular vet appointment because the vet wasn't seeing regular wellness checks at that time because of COVID. And so my mom didn't have an appointment for them. Ended up that my mom ended up needing to take one of my appointments when the vet kind of opened back up because both of her cats were vomiting and not eating. And it turned out that they were both in renal failure. So it was a mad rush to see what we could do. And because of Floppycats, I was able to post about Camus, and somebody who now is a close acquaintance of mine said, I don't know if you've seen this, but Dr. Margot Roman had a success story with a chronic renal failure cat using ozone. And I was like, what is that?
Hmm.
So at that time, so we were seeing a vet that we had seen for like 20 years. And then we had started to see a holistic traditional integrative vet for acupuncture. So I had these two vets, and Camus meant the world to me, and I wasn't ready to let him go. And so I wanted to do whatever we could, and ozone seemed to resonate for me. So I went on a mad hunt to find a vet in Kansas City that was doing ozone. I called everyone, I couldn't find anyone. And then finally, I called a holistic vet probably 30 or 40 minutes away. And I actually called them today on my walk, and they are still doing it, although Dr. Ferris has retired. Northland Animal Hospital still offers ozone. So I made the appointment, and Camus was like on his last legs. And I was like, there's no way that, like, what are we doing to this cat? We should just put him down, Mom. I don't know why we're trying this. And she's like, you've made the appointment. You wanted to do it. Let's just do it and see what happens. So we take him, and Dr. Ferris talked about how when you first start ozone, and especially on a very ill animal like Camus was, you have to go slow and steady, like, and you build up to the amount that
Mm.
the vet wants you to be administering. So I think um, I don't. I'm just gonna say that the first one was 20, second one was 40, and the third one was 60. And I'm not gonna say anything more because I don't want people to like do it at home. Because Camus was his own. That was the advice of Dr. Ferris at the time. And the next day, I was at my parents helping them in their basement, and Camus came downstairs like he was normal again and totally fine. And I was like, what? What? Like I had seen him so lethargic and so down that I was like, there's no way. There's no way that it was that gas that they stuck up his bottom for um to do that. So that is what made me passionate about it, was how quickly I saw a very diseased cat turn around.
Mm. That's
I don't know
great.
if you know that whole story, but
Yeah. Yeah.
I've done an ozone seminar with you when you were very generous with me. I was super nervous presenting, and so I shared some of that. So then, like, driving to Northland Animal Hospital was what, a 25-minute drive, and it was the middle of summer. So here I am taking a dehydrated kidney cat in a hot car for 25 minutes every I think we went every 3 days. And I was like, this is too much. So I was like, is there a way that I can do this at home? And Dr. Ferris said, yes, there's O3 vets. And I was like, okay, tell me more. And then I think I got in contact with you guys shortly after that.
Mhm.
Okay. So I've skipped around and not so what I wanted to start out with
Mm.
also was, what's your background? How did you get into this?
Yeah. Well, first of all, I'm glad you found Dr. Ferris and found us. I appreciate, just hearing your experiences with it. It's encouraging. Um, but I started maybe I started getting involved in different integrative medicine type things, holistic medicines things, for my work about 15 years ago. And was working on the human side, not with animals at all, with something called ultraviolet blood irradiation. And then started going to conferences to talk with medical doctors about that particular modality. And some of the conferences we were going to were ozone conferences. They seemed to really congregate there, and there was a lot of energy and excitement around ozone therapy there. And so I started to hear more about it. And then I had the opportunity to travel a little bit and went to a few different uh, met some groups in Spain and Japan and other places with doctors who were doing ozone therapy, and sat through some lectures and conferences and trainings. And then as I brought that knowledge here, or gained knowledge myself in that area, I realized nobody was really promoting this for animals here in the United States, and saw a real need for that and an opportunity to help some of the veterinarians develop some training and equipment that would be better, suited for animals. And so just started little by little there. And then recognized too, it wasn't just veterinarians who could do it. Actually, people could treat their own animals at home. And so that kind of was a little bit, that wasn't a plan. That just kind of happened. And then people like you, who are weird in a way out there, crazy, doing everything on their own animals at home, were like, hey, I could do this too. And I was like, yes, you could do this too. And then I was doing it, of course, myself. So, it just made sense to kind of get into that area a little bit. And so here we are. We started O3 Vets about 10 years ago. And we're looking to actually morph into having O3 pets as a separate kind of identity, because a lot of what we have on our website and a lot of the training we do and stuff is really geared towards veterinarians. And so in last quarter here of 2024, beginning of 2025, we're going to put some energy towards just making it more understandable. We're revising some of the equipment. We're making it more geared towards the pet guardian, in at least one of the branches of what we do. And I think that's exciting to me because it's to make it more user friendly and more accessible.
Yes, that's awesome. Yes, because I got a crash course in it.
Yeah.
When you have a really, really sick cat and you didn't have time to, I don't know, kind of learn it slowly and understand it fully. Yes. I mean, now I feel like I have a way better grasp on it, but that was rough in the beginning. I like the O3 pets thing too, because you could start seeing some really cool content as well, from people
Yeah.
and like how they're using it and like, wow, I didn't think of doing it, for that. Or so one of the things that wanted to talk about too was how, if you're interested in this, like how do you approach your veterinarian? And so I wanted to share my story. Our veterinarian is Dr. Sally Barchman. She is awesome. She is such a good human. When I started at the beginning of this interview, so we had our old vet and we had the acupuncture vet. That's Dr. Sally. And our old vet, I'd asked them both, would you be willing to hop on the phone with Dr. Margot Roman and talk about Camus's case? Our old vet said, I'm not sure. I don't think I have time for that. And we had gone to her for almost 20 years. And then Dr. Sally said, yes, I will work it into my schedule and make it happen. And that is one of the reasons that we go to Dr. Sally today, because I don't expect a veterinarian to drop everything they're doing for me. Certainly not. But what I do hope for is an open mind and a willingness to learn, and especially on a holistic side, because that's so less damaging to the microbiome. So which the microbiome, what I've learned in the last 2 years because of my cats, is everything. So Dr. Sally said, I'm not sure if I'm going to take on Ozone, but I'd be willing to talk to Dr. Margot Roman, get an understanding of it so that when you have me or Dr. Ferris to talk to about this. And I was like, oh my gosh, like, when you're under that kind of stress and that kind of initial, you're starting your grieving process of losing them anyway. When somebody lends a helping hand like that, it's amazing. So about a month before Camus died, I brought him to Dr. Sally for acupuncture, and she wasn't allowing anyone to come inside because, again, it was 2020. Camus was diagnosed in June 2020, died in December 2020. We were told he probably had like a couple weeks to live at the beginning. So the fact that he lived 6 months was a lot, and it's all mostly thanks to Ozone. He was on some supplements and stuff too. So she takes him back, and he was doing well. So I wasn't expecting anything but her to bring back the cat. And she comes back and she has this horrible look on her face. And I'm like, what did you find? And she said, Jenny, he has necrotic tissue in his mouth. And I was like, I don't know what that means. What does that mean? And she's like, dying tissue. It happens with kidney cats, and it can get very painful. You need to think about putting him down the next 2 weeks. And I was like, what? So I said, well, what about Ozone? Why can we try Ozone? And she was like, sure. I think actually it might have been 6 weeks before he died. And so I called Ferris, talked to her. I always call her Ferris. I should say Dr. Ferris. I called Dr. Ferris, told her the situation, and she said I would syringe ozonated saline over that 3 times a day. which was already pretty easy because I was giving him ozonated saline sub Q. And I brought him back to Dr. Sally. I think 2 weeks later. My time frame might be a little off. It might have been a week later. And she's like, I've never seen this before in my life. I've never seen necrotic tissue repair itself. I didn't think it was ever possible. And I can't speak for Dr. Sally, and I should ask her this if I remember next time I'm in with my cat Charlie. But I think that was what proved to her that ozone was worth having in her clinic, because it was so like, whoa, how is this even possible with a cat with no like blood work numbers like he has for that tissue to repair itself? So I was thinking on my walk, how do you expose new vets to this? How do you show them that this works unless you have a Camus and you've got the other vet at Northland Animal Hospital already doing it, so that, you know, there's education there. Can somebody like me that might be interested in it do it without having the veterinary support entirely? Like maybe show me how to do an enema, because one way that you administer, and we should talk about that how you administer ozone.
Yeah, because it is an uphill battle, right? Trying to convince veterinarians who are not open to it. Now, if they're a holistic veterinarian, I think there's a great likelihood that they'll be, willing to try something like Dr. Sally.
Yes.
Who I saw in Kansas City just a few weeks ago.
Oh, you were here?
Yeah, for the Fetch conference. Yeah.
Nice.
But yeah, so but it's I would say, if you have a holistic vet, yeah. If you don't, and you're looking to do ozone therapy still, then it is possible to do it at home. And I think, that usually what you're going to need is an ozone generator. And so it's not like free to do. You need to purchase that and get the equipment necessary. It usually costs somewhere around $800 to $1,000 to get everything you need to do ozone therapy at home. But then you've got it for good, and you can use it on multiple pets. I know a lot of people who do that. And a quick story that came to mind, I was talking to my mother-in-law 2 days ago, I think. And she has a little cat. That's 11, I think. And it had an infection in its mouth. Well, actually, she didn't even know it. She took it to the dentist. I think it wasn't eating. And they found infection and stuff, and put it on antibiotics. And it's Katie May is its name. And Katie May didn't respond. There was nothing really happening positive. And she ended up not eating for like 8 days. And she's small to begin with, pretty small. And so she's getting smaller. And so anyways, and I don't know exactly what happened and why, but we sent some oral gel back, which is an ozone infused gel for the mouth, so that she could apply it. She applied it that evening, and she said, like 4 a.m, or something. Katie May was like pawing at her and stuff, and trying to actually pawing at her at a food bag, ripping a food bag open. Hadn't eaten in 8 days, and all of a sudden she was trying to, and she said she scarfed down food for the next 24 hours. And she's like, she was convinced it was the ozone that did it, because nothing else had been done. And I was like, that's pretty crazy, and pretty amazing, but I'm happy that it happened. And she's like, well, it wasn't just that, because it's helped me too, on multiple occasions when I wanted to heal something. And so, there's some really cool things that take place. I get, it's encouraging to me, because I'm skeptical to begin with. I'm skeptical of my own stuff, like my own product. And so when I hear people, it's crazy, because there's lots of studies and but when I hear people who have something really cool happen like that, and it's fairly frequently, I got somebody the other day too, who was saying It's the only thing that has helped their Frenchie with staph infection to resolve that. And just really just saying, I've tried antibiotics, I've tried these other things, and nothing has helped. And it's really encouraging to hear that. But there are topicals, which is the easiest way you can apply it at home if it's a topical concern. If it's not, then having an ozone generator and being able to produce ozone on demand so that you can do something. If you have like a kidney cat or something, topicals aren't going to cut it. So you need to be able to do, like you said, the enema, rectal insufflation, we call it, to be able to infuse ozone into the system, which has the systemic effect that we're looking for. So that is feasible. You don't necessarily need a veterinarian on board. You can treat your own animals. You can do whatever you want. And so you don't need that. We do have, we encourage people to have a veterinarian on board if they can, but if they can't, it's not a showstopper. And we help people understand how to use it.
Yes. Yeah. And so another way that you can use it is ozonated saline.
Mm-hmm.
So use a bubbler, which is what I did on Camus. And I've also done ozonated saline on my cats, Charlie and Trig. Trig passed, as I told you. But I gave them oral ozonated saline all the time, especially during allergy season. Mm-hmm. Charlie is not a candidate for rectal insufflation because that is a no entry point for him. And so I didn't actually think Charlie's alter ego at the vet, and usually in most veterinary situations, is Chucky. And I didn't think I'd be able to give him fluids even because of that. And so when he was diagnosed with kidney disease initially, I was like, I'm going to lose him quickly because I'm not going to be able to keep him hydrated with fluids like I have, 4 other kidney cats. Much to my surprise and delight, he is allowing fluids sometimes. Like yesterday, he was like, I think that's enough. I'm not going to sit here any longer. But I am putting ozonated gas via syringe into his lactated ringers bag. I asked you about it and Dr. Sally about it. And that's the best option for him. And that's the other thing, is you have to take into account the pet that you have and their willingness. So like, there's no way that I would have been able to do the things I did to Camus without Camus letting me do it as well. So that's what I like too, is there's so many different ways to administer it, or there's ways to figure out how to administer it. I would probably give Charlie ozonated saline orally if he wasn't allowing sub-Q fluids at all. And even the sub-Q fluids, the way that I'm doing it, I'm warming the fluid. So the warmer the fluid, the less the ozone stays around, correct?
Yeah.
Right. So it's not ideal, but whatever. It's something.
Yeah. Yep. You do what you got to.
Yes. So let's say there's a veterinarian watching this. How can I use ozone in my practice? Like, what are the ways in which it would help my practice?
Yeah. Well, I think it helps to treat animals, first of all, that aren't responding to traditional treatments. So whether that's an infection or whether it's an autoimmune condition, sometimes it doesn't matter. There's many different diseases that respond well to ozone therapy. And the reason is because ozone it's something that helps the body do what it's supposed to do better by increasing intracellular signaling, increasing oxygen utilization, increasing antioxidant production. There's a lot of things that it really helps with. And so if you've got pets that aren't getting better, if you want to reduce the use of antibiotics or other cytotoxic drugs, then ozone oftentimes is a great modality to help you do that. So there's a lot of, we've got integrative oncologists who use it as an adjunctive for cancer, along with other veterinarians. It can be used for musculoskeletal disorders that helps reduce pain and stuff in joints and inflammation. So there's place for it in every practice, regardless of what you do. So I could talk about it for a long time, and I won't, because it would get super boring. But I think as a veterinarian, it makes so much sense to bring into your practice.
Yes. Well, I mean, I was thinking about it, like dentals, surgeries, like
Yeah.
all of those kind of things. I would imagine you'd have a quicker recovery.
Yeah.
If I had a dog or a Camus, I might just, oh, we're in for a wellness exam. Yeah, give them a
Yeah.
rectal ozone boost, no problem. I think that's how I'd approach it. One of the
Mm-hmm.
ways that it can be administered that we didn't talk about was drawing the cat's blood or dog's blood, ozonating the blood and putting the blood back into them. I've actually had that done on me. And the first time that I had it done, it wasn't planned this way at all, but I had 3 hours of sleep the night before. And when you get 3 hours of sleep, you're dragging the next day. And I went out and had my blood taken. And then I had it done at a medical facility, obviously, by I think it was a nurse practitioner or maybe an RN. I don't know. Anyway, I felt like I had gotten a good night's sleep, eaten well, exercised. Like I just had a good feeling of well-being after it. And I was just curious after everything that I had done with Camus to see what it was actually like. And that one interested me the most because it made sense that it could like clean my blood. So I think that's a really powerful medicine that you can do as well for more of a chronic patient. Is that usually how that's used?
Yeah. For we call it major autohemotherapy. Yes, I would say so. Yeah.
Okay. And then ways that people have been using it at home, obviously from kidney cats and then mouth stuff, and your mother-in-law's cat. Did she just do one application of that gel?
Yeah, it was just one. I think she
gosh.
did it multiple days in a row after that for sure, but I think she's been putting it on. She's like, I'm going to do this every day for the rest of his life.
I know.
Like, you don't need to do that.
So that's something to talk about. Like I was thinking, I wonder if people think that once you start this, you have to keep going, but it's usually more of acute issues I've found, unless you have a chronic disease going on.
Yeah. I mean, you're not going to just keep doing it for good. Just like any treatment, you can do it as a wellness treatment once a month. That's great. You should do that. But yeah, when you're treating a chronic or acute illness, it might be one treatment, it might be 15 treatments. It really depends on what you're treating, and it can be ongoing. In some like cancer cases and stuff, we recommend them continuing to treat at least once a month, but maybe even once a week, ongoing. It's a really wide range though.
Yes. And so how it's usually also sold at a veterinarian is they usually sell it in like a package, much like an acupuncture package. And what was very surprising to me was that my mom, who had the same insurance I do, which was nationwide, they covered Ozone through our veterinarian.
Okay. I need to say something about that, because I talked to somebody a couple days ago about this, and it just spurred me to think. I was actually very surprised is they actually got all their equipment paid for by Nationwide to do it at home. And that was the first time
I tried that in 2020 and they wouldn't do it.
Yeah. So something changed.
Okay. This is what I think the difference is. If you buy the equipment through the vet and it's on a veterinary invoice, I bet is the difference. Mine wasn't.
Well, yeah, that I can't remember how we invoiced them and whether or not it came through the vet, but I do know the vet prescribed it for them. And they had that on the treatment plan that you need to do this at home.
Yeah. Okay. That would probably help. I argued back and forth because I don't give up easily. When I was like, as I was trying to explain to them, this is far more economical for you and for me over the course of this cat's life. And uh, well, that didn't matter. Um, but I was like, and also, putting the stress on the cat going back and forth and all that
Mhm.
stuff. So it made a lot more sense to do it at home. And that's awesome that they covered it.
Yeah.
But don't assume from what we've said that if
No.
you're with Nationwide that they will always check and do your due diligence. Because I'm on a grandfathered plan too, so I
Mm,
don't know if that what that
yeah.
person is on. Um, okay. I have gone through all the questions that I have. Did you have anything else that you wanted to discuss?
Well, I think that's probably enough information for now for people. If they're interested, they can reach out to us. But we do have a Pet Ozone Summit coming up. And I don't know when you're going to post this, so it might be over at that time, but I doubt it because it's October 26th. Um,
Yes, it will be posted before then. So will
okay.
you send me a link to that so that I can
Yeah.
include it, please?
Yeah. So that's
Okay.
free. So if anyone wants to jump in there and be a part of that, we have 6 or 7 different veterinarians lecturing on ozone therapy, and it'll just be a really good time.
Okay. That's cool. Are you finding that like when you went to the Fetch conference, which I didn't know about in Kansas City, terrible. Um, like are are veterinarians signing up for it because they've heard about it, or how is it being spread?
Yeah, the Fetch conference was a dud, first of all. So that
Mm.
nobody's signing up for anything from the conventional side, really.
Oh, darn.
so, so, that's difficult. It's not worth the time, really, with
Mm.
veterinarians who are conventionally minded, to try to break down that wall at this point. Um, Holistic integrative veterinarians are much more open to something like that. And, some of them just do their own research. Some of them, it might be a, a webinar or a conference where there's lectures on ozone therapy or something else that's going on. I mentioned the summit, it's virtual, so it's online, and we do that for veterinarians once a year as well. So trying to educate, veterinarians, but yeah, it's few and far between that are really interested in something that they hadn't heard of before and that's not taught in the university.
Yes, yes. Ugh. I don't know how to make it more universal. Like even Trig, I ended up having to take to the ER a couple of times, and it's just it's hard to know about all these cool modalities like ozone and not see them in a place like that I'm like, oh, that could be taken care of really quickly if you just like squirted some ozone on there. So
Yeah.
that's I don't know how you get the word out other than educating pet parents, because usually I feel like
Yeah.
it can go up.
Yeah. Yep.
Yeah.
Yep. Exactly.
Okay, so I'm going to include a link to your website as well as the ozone conference in October. And then I will also include the links of the videos I did with Camus. So if people want to see what the process is of doing this at home, if they're interested. I'm actually working on a fluid video about Charlie now. And so I'll show ozone in that as well, and
Awesome.
eventually add it to the description for this. Thank you for being here.
Thank you so much. I really appreciate it.